Good afternoon. We're going to do our lesson today on the history of infusion therapy, and I'm going to go over to our Module 1 objectives. By the end of this module, we hope that you'll be able to compare and contrast the different periods of history in relation to infusion therapy, and also verbalize the understanding of the role of the Infusion Nurses Society for infusion therapy. Go over to PowerPoint here. So when we think about the history of infusion therapy, really infusion therapy has had a history of trial and error. Basically, when infusion therapy first began, physicians or lay people were using animals' blood to try to transfuse patients who were in need, who were sick, and of course that didn't work out very well. So you can see the early history and methodology. The Renaissance period is kind of where it started. In 1656, Sir Wren actually used opium to administer intravenously into a dog using a quill and bladder. And I tried to find a picture of a quill and bladder for you, but I really couldn't find one that was good enough that you would really be able to tell what was going on. Another key point in time in 1667, a 15-year-old Parisian boy was the first person to receive a transfusion. Of course, they were using lamb's blood at this time, so you can imagine that probably didn't go very well either. And then in 1687, animal to human transfusions were actually prohibited by law because there were so many deaths, so many adverse effects of transfusions that the government actually decided to outlaw that. Simply for safety purposes. Then in the 19th century, James Blundell determined that animal blood was not a compatible substance to use for transfusion for human blood. Novel approach. And he realized at that point that there were some safety concerns, of course, which we would all kind of imagine. So once the safety concerns developed, we had issues with complications just from the transfusion reaction, the incompatibility of the blood, but we also had issues with infection because at the time infection control and infection prevention techniques had not really come about. So they were transfusing these foreign substances into humans, and along with all the other complications, infections came right along with it. Then, however, we had an increase in the study of bacteriology, pharmacology, pathology, and that really kind of broadened the scope in the late 19th century for people to start to understand what was involved in the transfusion process and exactly why the animal blood and the human blood was not a compatible substance. Then in the 20th century, we had rapid advances in IV therapy. IV needles were developed. They were metal. They were reusable. But they did have a method for actually injecting the substance into the body. And then blood transfusions and parenteral fluids became possible because they had determined or had established a way to actually gain IV access to these individuals, as well as Pasteur, his take on infection control and sterilization really helped to minimize the issue with the infections and other complications that were associated with the transfusion therapy. Then in the 1950s, when plastic came about, we had this huge boom of equipment, medical equipment, and changes to infusion therapy where they actually went to non-reusable, disposable cannulas for IV catheter insertion. So again, this minimized that risk for infection because these pieces of equipment were not having to be sterilized and that kind of thing. It was a sterile procedure every time, so that risk of infection was minimalized. Then in the 70s, people really started to realize that IV therapy was a specialty, especially within nursing. Of course, today we have nurses that actually insert peripherally inserted central lines, which used to only physicians could do. So we have a huge advancement now with the use of IV therapy and infusion therapy within clinical practice. We also now have the Infusion Therapy Society, Infusion Nurses Society, and they are actually the credentialing or specialty body that governs nurses who are actually licensed and specialize in infusion therapy. And they have their own set of standards of practice. And if you'll, in your textbook, in Plumer's Principles and Practices of Infusion Therapy, you can actually see on page 10 the Infusion Nurses Certification Corporation, the vision, mission, and values for that organization. And then, like I said, you can get on the INS, which is the Infusion Nurses Society, and you can actually see their standards of practice as well. So now we have this large group of nurses who actually specialize in infusion therapy, and that are, sought after in their field, especially for PICC insertion and that kind of thing, as really a specialty field. So today in nursing in the 21st century, we have a group of nurses who are responsible for integrating the holistic principles of medicine and nursing, management, marketing, education, and performance improvement into the patient's plan of care. So this entire subset of nursing specialty that we have established within the nursing profession at this point in time.